introduce our second expert speaker, Dr. Girish KJ, Vice Principal and Professor, Department of Kayachikitsa, Patanjali Bharatiya Ayurvigyan, Evam Anusandhan Sansthan, Haridwar. Dr. Girish has more than 23 years of rich teaching and clinical experience. His areas of expertise include Vajikarana, gastrointestinal disorders, metabolic diseases, and rheumatological care. He serves as the editor-in-chief of the Scopus Indexed Journal of Ayurveda and Holistic Medicine, JAHM. As a postgraduate guide since 2007, Sir has successfully guided 30 scholars and currently mentors 7 more. With 42 scientific publications to his credit, he also serves as an Ayush-funded principal investigator. He is the creator of the Ayurveda Research Database and the online thesis directory, widely used by scholars across India. He is recognized for his academic leadership, clinical acumen, and excellence in research methodology. He will be presenting on the topic Mastering the Care Guidelines, Ensuring Quality and Transparency in Case Reports. I welcome you, sir. Over to you.
Thank you, Dr. Isha, respected principal, and all the faculty members of esteemed college. So, next 45 minutes, I'll be very, very quickly walking you through in and out of, rather, in and around the about how to write case reports, right? So all of us should be aware, as especially postgraduates should be aware. Hope I'm audible,
Yes,
Dr. Isha?
Yes, sir, you're audible.
The audio quality is okay?
Yes, sir, audio quality is fine.
Fine, thank you. So all these writing guidelines, whatever the article that you write, should start with Equator Network. So all of you, please make a habit to visit equatornetwork.org, equator-network.org very frequently. So case reports, I believe, that are the heart of Ayurveda, publication. Over 20 years of 25 years of research experience, clinical trials or clinical studies, they will give, rather they establish the efficacy of a drug and no doubt safety. But case reports, it's a story of a case, really gives you a picture and boosts your confidence as a practitioner. So case reports are real-time, say, story of a successful story which narrates and which gives you a wonderful guideline whenever you come across any case. I am here to say that case report need not always be very special. As a practitioner, as a teacher, I believe that case reports carry more weightage than a clinical study, publication. So in Equator Network, you should be going through care guideline. So read care guideline, CARE. So CA from case and RE from report makes a case report guideline or care guideline. So this is a guideline that you should be following. So obviously, all of you should be aware, are aware that Ayu care is there. Ayurveda plus a care, that case reports published from Aya, is one and only Ayurveda journal exclusively dedicated for publication of case report. So So whatever may be the reporting guideline, you need to be aware that for those who are not well versed, hope this is much more visible. I have not prepared a PowerPoint. PowerPoint would be very, very scholastic, but a real-time experience into the website will give you an idea. So care guideline has got a checklist. Any reporting guideline has got a checklist. So they are the standard checklist. Say if you want to publish a case report of any sort, right? So you need to look into the checklist, right? Checklist. So checklist, I don't want to waste my time in telling what is case report. Case report is a special case that you want to narrate. I'll tell you what are the possible areas in which you can publish little later when we go through care journal guideline. So the care checklist 2013 as published in the care-statement.org has got a 13 items. Dear friends, you need to be aware about this. First one is title. It should have a word case report. Case study is different. Dear friends, please note that case study always a methodology, right? Case studies are methodology. Case study about an institution. No, it's case report is mostly, points towards, biomedical, right? So it should contain the words case report. It can be related to diagnosis or an intervention of a primary focus. So title should be containing case report. So keywords 2 to 5, right? Again, it can be about diagnosis or intervention. So that then abstract, it can be structured or unstructured. I believe that structured abstracts are more recommended, because if you are writing like a diagnostic approach, it can be unstructured, but when it comes to intervention or a treatment of a condition, a special condition with good success, it should be structured. So obviously, the abstract should be having introduction. Especially, you should be focusing what is unique, special. It is a case history, case report about a condition. What is special about that, right? So even the title should highlight the special say aspect of the case report that you're publishing. Obviously, the first sentence, or rather the introduction, should highlight what is unique about the case, right? Then what are the main concerns, important clinical findings, primary diagnosis and intervention and outcome, and conclusion. Obviously, introduction, that gives background, then methodology that is followed, what are the important findings, and at last, what is the takeaway message? Takeaway message, or take home messages in the form of a conclusion. So abstract should be structured. So then coming to introduction, that is the fourth point. A case report should have introduction, briefly summarizes the uniqueness. Please take these words into your mind and heart, because if you find any case as special in terms of, say, diagnosis, in terms of treatment response, in terms of treatment outcome, hope all of you can make out this, right? Treatment response, treatment outcome, or even it can be adverse drug reaction. So whatever the case that you treat in the OPD, right? OPD or IPD, you believe as something special, you mark it as unique. So what you need to do is just think about start collecting information about that case. Whatever the document you have, all of us are having, mobile with a very good resolution camera. Download a PDF scanner software, doc scanner. I'm using. It's very helpful. You can create a folder, of that particular, say, case, start scanning whatever that you get. So the first important as the component of writing a case report is collecting whatever that is available, whatever that is available. It can be audio, it can be a video, it can be any report, right? All the report that is available with the patient. If you have data, say, then you can arrange it in, say, chronological order, then you can think of publication. So next, fifth point is patient information. De-identified patient in specific information is very important, because patient, what do you call, blinding the patient details is very important, because the privacy is important. This privacy, say, privacy of the patient is of primary importance. Next point is primary concern and symptoms. Obviously, then medical, family, psychological history, all history, past treatment and their outcome is very important. Sixth point is clinical finding. What are the clinical findings, right? In terms of, say, physical examination, right? Then most important, the core aspect, I'll show you some examples, is about timeline. When you write a case report, timeline is very, very, very important. So it's like, it should, no, the case should be, de-identified, as it is mentioned, rather de-identified, but date wise, presentation of the information is important. Mostly it should be in the form of a table. Next, the core aspect. Core aspect of writing a case report is, it can be related to diagnosis or, say, intervention, treatment of a case that you feel that it is special, is diagnostic assessment. See, we are all are good in, applying our logic when it comes to a case. So your presentation of the case should be such that, the very diagnosis can be always questioned, but when you write a case report, the diagnostic approach should be convincing. So that includes physical examination findings. Most important, the evidence that you should be collecting is from the laboratory evidence, tests, all imaging. Then, see, I need to focus on this. If you have, laboratory testing findings, then most important is image. Then it really strengthens the diagnostic, say, correctness, appropriateness of that particular cases. Then, if at all, if you are when reporting a case, it can be about if it is related to diagnosis, what are the diagnostic challenge that you faced? Then, at last, you should arrive at an appropriate diagnosis. Then, most important, sadhyata, sadhyata, or prognostic characteristics. So, if you are when you are doing a case report, you are trying to highlight. I need to say that you need to be unbiased, or you need to be scrupulous in stating that you have correctly, appropriately have diagnosed it. You have appropriately, what do you call, done prognostication of that case. So then, ninth important point, after diagnosis is a therapeutic intervention. How you approach the case in terms of pharmacologic, surgical, or preventive, or whatever. Then how you applied the treatment in terms of dosage, strength, duration. Then what are the important changes or improvement, or whatever, say, in the due course. So this, diagnosis and therapeutic intervention or treatment that you have given should be recorded in a temporal, rather, say, date wise. Timeline is very important. You need to understand that timeline is important. Next, important point is follow up and outcome. So when you state or present a case as special, you should have some follow-up and follow-up data at the same time. What happened to that case, right? So Here the case report is not only from your perspective, you may add a patient assessed outcome if available. So if both the perspective are there, so there is a scope for you to present both say from the doctor's perspective or physician perspective, at the same time say patient perspective, right? So if at all you have done some other follow-up tests or say images you have taken, say usually when you make a claim, for example, you have treated multiple sclerosis or chronic kidney diseases. So obviously the patient, there is a common what do you call? Not common. It is medically it is correct to say that they are incurable conditions, but the case that you have treated, you have received an excellent result. So obviously there the patient as well as, I'll tell you, the case reports are really, if you want to become a good practitioner, if you want to have a good number of patients seeking your help, especially in very difficult conditions, you should be publishing case reports. So one of my students, he published a case report. He's in Delhi. He published a case report on I think multiple sclerosis. Huntington's chorea. I have got at least 20 calls, 20 to 25 calls in last 5 years, right? So I would give credit to my student who is at Delhi. Then I would give his phone number, and I would say that he has treated it. So please follow up with him. So case reports can really help you in attracting good number of patients as a practitioner. 11th point is discussion. So strength and limit in your approach. Then discussion of relevant medical literature, the rationale of your conclusion, on what basis you took a conclusion, and at last take away lessons from the case report, right? So that is the 11th point. 12th is a patient perspective. In the care checklist, patient perspective is also given place, and the core of everything is informed consent. So whenever you think that the case is very special, first thing you do is to get a written consent stating that the details will be hidden. So and the patient is agreeing for the information or his case report being published. So without a case rather informed consent, please avoid doing that. First thing you should be know, because whenever the patient is available and whenever you feel that the case is worth publishing, you feel that you have got excellent result, don't worry, it can be an ordinary condition. For Ayurveda, for example, treating Amavata is an ordinary, it's a day-to-day business for us. Treating a case of IVDP is a day-to-day business for us. We get excellent result. Treating psoriasis is an excellent result. It's a day-to-day business. It is common for us. Dear friends, please understand that when the public or the people around the globe are not aware that Ayurveda can give excellent result in n number of conditions. So whenever you publish a case report in any type of journal, no doubt there are n number of journals. I believe 50 plus journals are there. You have to find out the quality. But as a beginner, it should not prevent you from publishing in an ordinary journal. I don't want to judge, because publishing it in a high quality journal takes a lot of courage, a lot of practice, but that should not prevent you from attempting that. But you can publish it in an ordinary journal. So the first thing, especially those who are in undergraduation or those who are new to publication, please start with the case report. Publish at least 5 case reports in an ordinary journal, then you can submit it to a higher journal. Because writing a case reports requires a certain it requires patience. You need to be thoughtful in creating the story of the patient. So this whole last 10 minutes I highlighted that care guideline has got a 13 checklist. So your case report should contain these 13 points, right? So next, writing the in the care care statement, you you have a section called as writing the case report. This is how you can write a case report. So the first important point is you should feel that the case report is you should feel that the case has got something special to it, right? So let me show you straight away on what all aspects. Here is the, sorry, I'll show you. You can just do a search about Ayu Care. Here is the Journal of Ayurveda case reports published from All India Institute of Ayurveda, right? So this whole journal is dedicated by dedicated for publication of case reports in Ayurveda. So if you see, always whenever you go to a journal, you should read the scope 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 of the journal, right? And you should read abstracting and indexing information. So here, if you can see scope of the journal, hope all of you can see scope of the journal. So before you publish an article, you should go to a journal. So you should go to a journal and read a scope of the, before you read through the sample articles, you should read what is the scope of the journal. So Ayu Care Journal, Ayush Ayurveda, Journal of Ayurveda case report focuses on case reporting on exclusive Ayurveda diagnosis, known and unknown etiology of a disease in Ayurveda parlance, understanding disease on Ayurveda principle, presentation of rare, here I was telling, rare disease features, arista, as mentioned in Ayurveda literature. So this is about I was telling in the introduction about diagnostic aspect. Then those cases focus on differential diagnosis, case reporting of Nidanarthaka Vyadhi and Vyadhi Sankara, right? Then fault in Ayurvedic diagnosis, any other cases that supplement existing knowledge of Ayurveda. So all these are related to disease and diagnosis. Here I was telling a case report is about a diagnosis and a treatment. So let me get back, right? So under the scope of the journal, first point is disease and diagnosis. Second aspect that you can publish is treatment. Cases where Ayurvedic principle therapies procedures provide demonstrable relief, significant relief, right? So cases give new insight into Ayurveda management of a chronic and a rare disease, right? So significant clinical outcomes, excellent result you have got. Then demonstrate practical application of Ayurveda treatment principle. Case worthy of discussion, particularly around aspects of differential diagnosis, decision making, management, clinical guideline. Then cases exploring myths and truth regarding extent of Ayurveda treatment, unusual, unexpected effect of a therapy. See, I have seen a case where the patient could able to withhold, or he retained, Nirvabasti of around 500 ml for more than 2 hours without any. So you come across unexpected effect of therapy or treatment, including adverse drug reaction. So wherever Ayurveda is safe, but as a practitioner, as a clinician, all of us know very clearly that we come across adverse drug reactions, adverse events, so that they are worth the publication. Then you can publish cases depicting common error of management, right? in terms of fixation of dosage, timing, treatment response, choosing vehicles, right? Then referral cases from other systems. See, you have, you have a patient with you who is referred from a higher center or a modern medical person, and you have successfully treated. Most important is the failure management of emergency care. So innovative, you have developed an innovative protocol. I'll tell you, all Ayurveda teachers and most of the practitioners, sorry, most of the practitioners are good in treating some, say, clinical condition. So they, when they have, say, one case or maybe a case series, certainly it makes a case for publication. So first, under the scope is disease and diagnosis. Second, we saw was treatment. Third is complication and accidents, right? Then very important is adverse outcome of the therapy, drug reaction during pharmaceutical processing. How many of us are ready to believe that even Kshirvala Taila, right, Mahanarayana Taila, no, we know that they are absolutely safe, but still we come across some adverse drug reaction, right? Then adverse events you have given, say for example, say Brahmi or some Medya Rasayana drug, and being a driver, he took, 4 tablets or 6 tablets, and he became drowsy, and while driving he ended up in accident. That is a adverse event. Then adverse drug reaction, right? Ballataka, Vacha tend to develop a adverse drug reaction, or improperly, say, Shodhana being done, Rasoshadas may, say, uh, present with some untowards drug reaction. So they are also worth publishing. So I need to say that as a researcher, I believe that whatever that really makes you an interesting point, you should publish. Don't worry. Don't worry. If you see journals of, say, published in 1800s, they are simple narration of the patient condition. Similarly, the case reports are simple narration of the patient condition, right? So I just walked you through, if at all you are publishing, then what you should be publishing, right? What makes a case report? So what is this? We just saw from Ayu Care Journal, what is the scope, right? In terms of treatment, diagnosis, adverse drug reaction, maybe anything else. So let us go through among the 13 checklist, what you should be writing. When you find a case as special, the introduction, rather, the very purpose of care guideline is to report accurately and transparently, right? So whatever that you write about a case, should be accurate and transparent. So from that perspective, you need to follow this. Practically you need to follow this. So first, select a case, identify the message you wish to communicate. Right? You are treating a case, and you believe that yes, you have faced some diagnostic difficulty. Somewhere you misdiagnosed, somewhere you followed a specific line of management, innovative line of management for that case, and you have got excellent result. So that is how you can identify the case and identify the message that you want to convey to the audience. So basically, outcome, diagnostic assessment, intervention, new or rare disease, or anything else. These are the classes, right? Outcome means you have got excellent result, right? And the the condition did not relapse, it got cured, right? It can be an ordinary condition, doesn't matter, but you have got excellent result. And especially in a chronic condition, you could help the patient to cure. Or the case is about diagnostic assessment, it's about a treatment line of management, it's about a rare or new disease condition, right? Especially this COVID and all, they make an excellent then complications related to COVID, they make an excellent subject. So the first step is to select the case, identify the message. Second, very important, see, most of us are feel great and excited when we treat a case and अरे इसका बहुत बढ़िया रिजल्ट मिला है. But the next important thing is gathering the necessary information. If you don't, you get excited about it. Oh, I missed, I did not scan the file, or I did not scan the report, or it's missing. When you publish a case report in a good quality journal, they want all the evidence in terms of diagnosis, in terms of treatment, in terms of treatment outcome, then follow up. So gathering as much as information, then de-identifying is very important. Gathering the information in terms of timeline and converting it as narrative, right, is very important. So whole purpose is to narrate or give a summary, visual summary of what has happened with the case, right, before writing that. So second important step is gathering the information as much as possible, including a very important is a informed consent. So first, selecting a case, identifying the message that you want to give. Second is gathering the as much as information and write what happened as timeline is the second step. Third, complete the remainder of the case report using specialty specific information. So you have decided that there is a message in that case, you have collected the information. Next important, before you write, please go to a journal. I'll tell you, here they have given, I think they have given a list of journals. Here is the list of incomplete journals. And I was wondering to see that there are, there are huge number of journals, let me enlarge and show you that. See, there are n number of journals. There are n number of journals in modern medicine. I could able to find out, say, integrative medicine, a clinician's journal. So there are n number of journals. Most of the journals may not really, accept our Ayurveda related journals. It doesn't matter. So there are many Ayurveda journals like IUK who accept our articles. Let us not worry, but in the third step, I'm sorry, where it went. I'm sorry. Where it went. I closed it. Just a second. Let me go to that. It is under author section. So first you selected the case, then you have gathered the information. Third, before you start writing, please go to a journal. Please, because time is very precious, and before you start writing a case report, decide a journal, because every journal expects you to write in a specific manner. The whole crux of feeling successful and feeling joyous and whatever jubilous when it comes to publication is about starting the journal. Start writing the article according to the journal. So, rewriting takes a lot of energy, right? So, specialty specific information with appropriate scientific references and explanation. So, you know, they say specialty specific information. I said journal specific. Here, specialty specific means whatever the system, every say srotas or organ system, there is this very specific method or approach or way of presenting the case. So when with appropriate sections, right, specific approach, so as an experienced physician or surgeon, we would know if a case is presented, for example, about psoriasis, you expect the history and the examination, clinical findings, and laboratory investigation to follow a specific, set of laboratory investigation. It follows a specialty specific information. So one is about journal specific writing, second one is about preparing according to specialty specific information, and obviously referencing style, everything is important. So support why an outcome occurred with reference to the scientific and historic literature. So everybody, so whenever you claim something that you have successfully diagnosed, or you have prognosticated, or you have successfully treated, they will ask you why. Why? So you need to have sufficient, say, literary, references or supportive document to say your this thing. So next important is de-identification. No, patient information should be de-identified. Before you submit it to the journal, you make sure that you have blinded the patient name, place, phone number, anything else. Because patient privacy is very, very important. Patient privacy is a very, very important besides a informed consent. So this is the typical sales steps you should follow when it comes to writing a case report. So next, quickly, part 1, writing sequence, working title, what happened, timeline, narrative. Typically, case report also follows a PICO, population, intervention, then outcome. Comparator may not be there, but population, intervention, then outcome, and timeline, right? So develop a descriptive, succinct working title. It may change. It doesn't matter, but you need to have a working title. Then you have to explain what happened, right? What happened to that case? The narrative and episode of the care that especially tables and figures are very much necessary. So when you narrate the case or episode of the care, the table should contain dates in one column, another column, what happened, what changes you observed, what treatment was given, what changes you observed. So typically, a case report will have a date, the condition, treatment given, and what is the outcome. So typically, this is a common. Before that, you may present the clinical findings. So it is like you are presenting the details in such a way that if it is presented to think 100 people, at least 60% should be agreeing to what you are saying. They should be convinced when it comes to diagnosis. They should be fairly convinced about the line of management. They should be fairly convinced about the treatment outcome. So that is the then evidence is very important. If you are making a big claim, see that there are laboratory investigations and say imaging, imaging that is supporting your claim. People will straight away say that if there are insufficient supporting, then in support, then they will say rubbish. They will say that no, this is not acceptable. That is one of the limitations. Just a description will not be sufficient enough. They need some evidence. That is one of the limitations. But you should be doing that with the appropriate photographs, images, then laboratory investigations, or maybe some imaging techniques. First one is about say writing sequence, working title, what happened, timeline and narrative. Second aspect is why it might have happened. Once you have narrated what has happened, then you have to say why it has happened, introduction and conclusion part, right? So introduction should brief about why this case is important, said most important, right? That is the first. Then why it has happened is in the discussion. Then conclusion, what you result that you have got with the reference. That is part two. Under part three, in the writing sequence, so once you have say narrated what has happened and then why it has happened, then you have to say you have to say you have to write abstract keywords reference. Every article per se has got uh, two components here, friends. One is takar, another is IMRAD, right? Takar or every article has got front matter, middle matter, and the back matter or end matter. So TAK, title, abstract, rather title, rather author details, then abstract and keywords make the front matter, whereas IMRAD, introduction, methodology, result, discussion, obviously conclusion, make the middle matter, then AR, acknowledgement and reference make the back matter. So as a part of part 3, you should be writing abstract, keywords, references, acknowledgement, and most important is the informed consent. So like any other article, I believe that abstract should be summarized in a structured format. That is really good. Unless you need to present it in a structured manner. I recommend that. Then keywords, references, mostly ICMJE, right? International Committee of Medical Journal Editors, they recommend a Vancouver style. So Vancouver style, otherwise the referencing style that is um, recommended by NLM, National Library of Medicine, is a Vancouver style. So you need to follow a journal specific guideline. Then acknowledgement, you need to acknowledge um, funding support, or if there is some conflict of interest, you need to be frank enough or open enough to say. Then very important is a patient informed consent and a patient perspective. So this is the approach. So first one, when you write what has happened, right? Second, why it has happened. Third, you have to conclude with the abstract, then keywords, reference. So what you need to do is you start with the middle matter. You start with methodology, right? Then narrate the result, then discuss why it has happened. Then you come to introduction. Once introduction is over, you can write the abstract, then finalize the title, and obviously, refine your references and other, end matter or back matter. So that is the sequence that you should be following. So it's already 8:45. So here is a writing tool that they have given in the beginning. So that is called as Care Writer online app. So I have just created what do you call created. I have not used it, to be very frank, but um, for one article it is free. So you can see it contains all the sections beginning from abstract, then keywords, rather keywords. You can write the keywords, then timeline, right? So you can add a timeline entry, right? Then you can work on diagnostic tools. Then you can add a patient perspective, then discussion, conclusion, acknowledgement. So it is a simple tool. It's a simple tool. Then you can do a preview of the article, right? So this is called as care-writer.com. So it is free for one article. Certainly you can make use, right? So it can talk about the versions. So no doubt, with a word you should be able to do it, but we need to be aware about the sequence with which we can start. So besides this, I need to show you, sorry, I need to show you about this. Yes, already I have covered. This is types of case reports, or I mean, I have already shown you this under the scope of the journal. What are the type of article that you can publish? One is about disease and diagnosis related articles, treatment, then complication and accidents, adverse drug reaction, right? Then miscellaneous and other. So when you prepare a manuscript for Ayu Care, hope this is should be visible, right? So, right? So all these are clear. Title page, then you need to submit in terms of article file, right? Don't reveal, it should be blinded. The main article file should be blinded, right? It should not contain any information regarding the place, right? The what do you call details about the author and the patient. You should try to blind the article, because this will be shared to the peer reviewers. Then somebody is writing. Can somebody clear the screen? Because that can be a distraction, right? Can somebody clear it? Yes, thank you. So the title page should contain all the information about the author and the places and the affiliation. The main file should not be containing any information, personal information. Obviously, whatever that I already shared, it should have an introduction, then what has happened, right? Especially here, uh, all Ayurvedic aspects should be covered. Dashavida Pariksha, Astavida Pariksha, Srota Pariksha, right? All Ayurveda, when it comes to Ayurvedic case report, in terms of publication in Ayu Care, should have an Ayurvedic approach. Then very important is timeline. I'll just show you one or two cases so that it becomes. Then diagnostic focus and the assessment, right? Then therapeutic focus and the assessment. Then most important is that makes the heart of the case is follow up and outcome. Then discussion, why the result, then the conclusion. Obviously it is like any other article, it follows. The reference should be, what is the referencing style? Can we make out? Did they cite about here is I think it is nothing but a Vancouver style of referencing, right? Vancouver style of referencing. So here is the examples how you can quote, cite a journal article, then books as author, books with editors, right? From commentary. So what you need to do is go through these referencing, style, because there is nothing called as universal referencing style. Even the journals, they say that they are following Vancouver, there can be a lot of deviation. So you need to go through the examples, or you can go through the articles that are already published. So here are certain general instruction, right? The Ayu Care expects you to italicize regional Sanskrit terms, Ayurveda terms, first letter of plant name should be, that's a common instruction. Then very important point is translation of Ayurveda terms into English word is not always possible. This is an important instruction. Some terms would require short description as parenthesis or footnote. Say, here I will show you the article. Say, for example, Vamana Karma is not exactly, or rather, therapeutic emesis does not exactly correlate with Vamana Karma. So the tilde, right, sign is used. So the whole intention of presenting in such a way is to reach to the international, say, audiences, international audiences, because when you publish, it should be reached to a maximum extent of audiences all across the say all across the globe. So rest all, like any other journal, the instruction related to, say, how the paragraphs, how the diagrams should be labeled, how the tables, usually tables are labeled above, figures are labeled below. So then they have given review process like any other journal, it follows. So here the patient consent, properly signed informed consent. This is very closely related to case report. Properly signed informed consent from patients, relatives, guardians as applicable must be submitted for must be submitted to the journal. Please anonymize patient details as much as possible. If the patient is deceased, author must seek permission from next of the kin. This is important. If it is not possible to get signed consent from next of the kin, head of the medical team or hospital or legal term must take the responsibility. Right? That's an important instruction when you publish a case report. Right? So this is required to be uploaded. This is required to this is required to upload a signed consent, rather document to the effect. So that is the core of a, say, case report publication. So there is in publication ethics. Then these are all, you can go through it. So here the checklist. Then obviously copyright is a part of it that you can go through. So next 2 to 3 minutes, let me walk you through a few of the articles, one or two articles. Here is the, I have just zoomed it. So, right. Here, I just skimmed through. Before that, I want you to see this BMJ case reports. You know, this contains, I think, more than 13 or 14,000 case reports. This BMJ case report contains more than 14,000 case reports. We are Ayurveda, we are quite slow, right? Here is this. The acceptance rate is 49%. BMJ is a very respected, journal, publisher, right? So this, about 3 years back, I had seen that this contains more than 15,000 cases. So when you go through this, here is the site score, then impact factor, right? So SJR is 0.29219. So whatever. What I want to say is that there are n number of possibility of publication of a journal, rather these case reports. Say, for example, let me walk you through 2 or 3 titles before I wind up. Yes. Here is the previous issue. Here you can see, let me take you to one of the issues. Say, how exactly a title looks. I mean, hypnotherapy as an add-on to Ayurveda treatment in the management of psoriasis, a single case experience. That's how they have worded it. Then Ayurvedic management of typical and atypical presentation of hidradenitis suppurativa nadivrana in young woman, a case report. Here is about a clinical presentation, right? Next title, management of Shutra and Ayurvedic therapeutic approach. It is about the treatment. It's a case of Shutra being successfully treated. Ayurveda management of Dushtavrana. Here you should be seeing the tilde signal, right? Tilde sign. Putrefied wound as Dushtavrana translated as a putrefied wound due to viper bite and experience. So this is about the one is about complication that is being treated, that is Dustavana being treated with Ayurveda. Next, one more title, management of Ardita in pediatric patients through Ayurveda protocol. Here, the case is related to Kaumarabhritya. That too, a Vata Roga being treated through Ayurveda. So, next example, management of abnormal uterine bleeding that's related to gynec, rather Prasuti, in a perimenopausal woman through Ayurveda and experience. So they have told experience. Androgenic effect. See, here is an adverse drug reaction. Androgenic effect need not to be. It's a beneficial effect. Androgenic effect of Makaradvaja in late onset hypogonadism. No, this is not adverse drug reaction. It's a success story, right? Successful clinical management, right? So management of herpes zoster infection over the face through Ayurveda adjunct to conventional medication. A case report. Here, adjunct, add-on therapy. So rather it is adjunct. So every case reports, you need to find out that there is some unique message that is conveyed first through the title, then the case report. For example, let me walk you through just the important content. Here, an abstract is there. You can see that the abstract is unstructured. Here, the abstract that is Ayurvedic understanding, management of Guillain-Barré syndrome (GBS) in light of Anuvata in an experience, right? So introduction, they have told about GBS. Then where did the article went? Okay, I'll take another 2 minutes and wind up. So introduction that told about GBS, then their prevalence, then there's a lot of description is being written. Next comes the heart of this article, that is patient information, right? All the details, the case scenario being presented along with the clinical findings. Most important aspect is here is the, hope this is visible. Sorry. As with the timeline, they have explained about what happened to the case with the date. So date is very important when it comes to case report. Then diagnostic assessment, how, right? Here you can find out that every Ayurveda word in Ayu Care Journal, parallel modern rather English terminology, approximate in the English terminology being presented. So the Nidana Panchaka being presented along with the Samprapti Gataka, Upashaya Anupashaya, then therapeutic approach, right? Therapeutic intervention or rather treatment that is being given along with, here you can see the on what date, what being given, or all the details are given. Then at last, follow-up and outcome. Here you can see with the date, right? With the date, here you can see before and after treatment, what are the findings in relation to the parameter. So there is no set format, right? Then they have discussed why the result they have received, right? What is the, see, extensively they have discussed why they have got the result. So the whole case is about, I mean, the point is about one case, right? Whole point is about one case. When you read such case reports, you will get a deep insight into a particular condition. Then patient perspective is also being given. Then declaration of the patient at last references. So I think that's all I have. If there are any queries, so I believe that all of us can put a hand, into writing a case reports. I believe that future days are for writing case reports in Ayurveda, and case reports can really, really bring a lot of patients to you as a practitioner. So I thank the organizers and hope I was useful in conveying a good message or a message that um, you know message regarding care guideline. Over to you, Dr. Arshijyoti.
Thank you, sir. Thank you so much.
Thank you so much, sir. We request all the participants to post their questions in the query in the chat box.
So the software is about case-writer.com, I think. Case-writer.com. That is there in the that is there case-writer.com. That is there in the care guideline site. So it is a paid one. For one case, it is a free. So it is not a software like when you really collect, extensively you collect the details. So writing, writing, you should start in the middle, putting all the details in a timeline. So that is the best approach. Once you have set the things in a timeline in terms of say patient examination history, patient examination findings, laboratory findings, then you should be writing therapeutic approach. Then you have to document what happened, what is the result. Okay. So how can failure of a therapeutic intervention regimen be reported in case report in a clear and objective manner while maintaining the neutral tone and emphasizing the lesson learned from the experience? Certainly, I can see it, the question is from Arshit Jyoti, right? That they're really contributory, right? Most of us take credit in telling how and where we succeeded, but we fail to report where we failed, right? So where it pinches. So nobody wants to say or show their weaknesses or being failed, but like journal of negative results. Similarly, you can certainly publish the article. It all depends on the journal. The journal should accept your article with an open mind and heart. And if it is really significant, always remember that publication involves a lot of, say, certain things that is related to the audience. So the journal always wants to retain their audience, right? So you can make, but when if you are not if um, you can discuss where it failed, why it failed, with equal say equally the way you are discussing how it succeeded. You can explain. There is nothing neutral. The failure may be related to wrong diagnosis or wrong prognostication or wrong application of line of management. Certainly, adverse drug reaction or a negative finding. So certainly you can publish. Um, how relevant is in terms of publishing case report that contains both Ayurveda and allopathic treatment combined? Certainly. So I just showed you an example of add-on therapy. adjunct, add-on, all are related to Ayurveda and allopathic treatment, where whenever allopathic treatment is involved, so it is better to have a modern medical person as your co-author for better acceptance, or giving what do you call authentic authentication into what you do. Certainly it is recommended. So those who are youngsters, maybe UG or PG, you should start writing at least 4 to 5 case reports. By the time you will get to know what is what, and of when you're writing a case report, that should be a first step. Those who have not published, please, my request is that we have spent 1 hour. The take home message that I want to give you is that write something about a case. It may sound, the first article may sound silly, and somebody say that ये तो हम तो ऐसे बहुत देखा है. It doesn't matter. Once you have documented, I'll tell you, the patient will come in search of you, because your visibility in terms of case report will get you a good number of patients. Okay. Next, is this guideline to be used when reporting an experience, such while formulating a medicine, or it is restricted to diagnosis, say with say experience while formulating a product, or if not, other guideline? Here, this whole case report is about diagnosis, therapeutic approach, prognosis, and adverse drug reaction. When you formulate a new medicine and you have applied it in a patient, certainly it can be published. Certainly it can be published with a statement that you have formulated a new medicine and you have tried, because it is about a real time, real world application that you are doing. There is nothing wrong in it, but you have to narrate how you arrived at decision to formulate a new, make a new formula and apply it. Yeah, you need to. It's about, see, what you need to understand is that case report is about narrating a condition in terms of clinical picture, diagnosis, treatment outcome, and explaining why it has happened. It's a descriptive, say, approach, right? Case report is a descriptive methodology, right? So certainly you can do. Okay. Are there any questions?
Do we have any more questions?
Oh, Srikant has asked. How are you, Srikant? I know that many of you are here. So it was really nice talking to you all. So, there are any questions? So my request is that start, those who have feel that they cannot publish or they have not published, they feel limitation. Say, take a week or 10 days time, write something. Let the first be a blunder, second will be better, fifth will be then excellent. Then you will think that yes, you have really the capacity to write. So don't listen to others. Whatever may be the quality of the journal, start publishing. I know most of us, get we take back when it comes to publication, stating that, oh, it's a big journal. Obviously, I'll tell you, 99% of the article, that we submit to a modern medical journal gets rejected. It should not hinder you from publishing. So my sincere request, wherever I go, I say that you publish. Let the first be a blunder. People say that you are spending 500 to, but you should not be happy with that. You should not feel proud. Certainly there are higher ups when it comes to publication. Not that publishing it in a journal of impact factor of 2 to 3 takes your 6 months of your time. So it's a tough task, but you should start publishing. That's my request. Not to be happy with uh, ordinary journals. Okay. Hope I have done justice to the time.
Thank you, sir, for a deeply insightful session. Are there any more queries?